They can't get the things that they need done because it just costs too much.
The medicine is expensive.
You want to feel like a person, not just a product.
We asked patients what they struggle with most and what they most want to see in healthcare. Then, we traveled to Chicago to the Becker's Conference to meet with healthcare executives and share these thoughts. Let's see what solutions executives have in the works.
And we find when the payer and the provider are most aligned in that conversation of care, it's so powerful. We see lower cost, we see better customer service and satisfaction, and we also see higher quality when that alignment is there. And it's alignment financially, but it's also alignment around process, eliminating these friction points in the system.
Can you give us an example of a friction point?
A friction point would be a care model. If, you know, in a lot of payers, and Humana is one of them, that you have a pre-authorization requirement. Well, where we have aligned interests, that pre-authorization is no longer needed. And so now the step is taken away. When someone gets discharged from the hospital home, there's someone there to help that transition, to make sure that they do get home and that there's a view of it. Are they getting the right nutrition? Are they getting the right care at home? And that to me is where it becomes really powerful. What we find is on the integration, it's around financial integration, so payment, and that ranges all the way from being paid on a percentage of our premium to more of a bonus payment based on quality and cost and based on a fee for service, but you have some bonus payments. But we find where it becomes really, really powerful is when you integrate processes, where we have specific nurses in hospitals that help in the discharge planning out to a home. We have about 9,000 nurses in our organization that go to people's homes and then circle back to the hospital provider and say, these are the things that are going on in the home to be well informed. We find whenever there's a change in medicine that we notify, because we see the prescriptions, that we notify the provider. So there's not a sort of a black box of all the different prescriptions people are getting. Yeah. And so that integration is not only around financial, it's around information, and that is really based on the processes there.
In other systems around the world where resources are much more limited, they take care of patients spending a fraction of what we spend. As you know very well, the feds think that 1/3 of the money that we spend in healthcare is a waste. Yeah. And I think they're pretty close to the truth. There must be a reason why the United States of America are the only country on the planet that spends double digit, about 18% of GDP for healthcare. And yet, when we look at the rankings, the international rankings, we are number 36 or 37.
A lot of our older generation folks are still very much dedicated to one physician. They will follow those orders of that physician, do what the physician directs. But the younger generations are much less tied to any one physician. They are much more interested in getting care when they need it, when they want it. They don't tend to have nearly as strong a relationship with their primary care provider. Yeah. So they are more willing to shop around to find what they need and find it at the time that they need it.
So I think we're just at the beginning of really absorbing what technology can mean in healthcare. We tend to be a laggard when it comes down to adoption of technology. But the real era for healthcare and big data is over the next 10 years. What we see is an explosion of analytics, not only in the hospital, but within the ecosystem of healthcare. What we are lacking today is the tools to synthesize the ecosystem and translate it into meaningful data that will help us to improve quality and lower costs. Quality absolutely does not have to cost more. Actually, true quality should drive down cost. In order for us to serve the markets and our clients that we need to today and in our short future, we need to really balance the equation. We should use technology as an enabler of quality, but only if it has better outcomes, and I would also argue drives down cost. Well, better access can only be really achieved when costs are affordable.
Sure.
And as we're moving to an era where the sustainability of our healthcare systems, the economy is not able to support it long term, we have to really be mindful of that. And so driving down the cost through technology as an enabler is a significant imperative for us.
But one of the things that we have to be mindful of is technology is really the enabler. It's not necessarily the driver.
Right.
And a lot of times in our industry, we have looked at that being the driver, and then we've backed into process and to people.
Right.
So what we've tried to do is really take a different approach, and we start to think about what is the problem that we're attempting to solve? How are we trying to enable the people to do their jobs better? And with that, we're going to layer a process on top of that. And let's really do a deep dive into that process to make sure that it's clean, make sure that it's lean, make sure that it really offers efficiency. And then we use technology as an enabler of that.
The successful approaches work best when you have multiple parties involved in trying to solve that cost issue. So for example, you really want to look at partnerships where you bring together the person who's utilizing the care, the provider who's providing the care, and then obviously the person or the party that's financing the care,
Right.
paying for it. And the best partnerships are when all three of those interests are represented.
Right.
I think that expensive technology can play a role, but it's appropriate care that's the most important thing to think about. So there's a lot of data and information now. Technology does play a role, I believe, in decision making and understanding in what circumstances and under what cases the use of expensive technology makes sense, because I do think at the end of the day it continues to be a value equation you need to think about.
Healthcare systems tend to be one-stop shops, and we don't need to be. There are different ways to deliver care, but it's going to take collaboration across systems and with providers and with the community and deliver care differently to do it in a more efficient manner.
When you work in an industry, you think you know what's best, right? So you say, well, here's how we're going to measure quality. And the government helps us measure quality. They say, here's how you're going to measure quality. And then you talk to people on the street like you have, and they say, well, honestly, that's not really important for me for quality. So we need to find out more about what the people on the street are saying is important for quality. Some things that I've learned in our communities is things like cleanliness of the hospital, the noise level, the way that they're treated. There's one thing that I could say that rises above everything else is how do I feel when I leave the organization? Did you listen to me? Did you care for me? You know, did I leave with more knowledge than when I came in with? If we can start to do a better job at some of those elements, I think we'll start to finally merge the two elements. And we need to do a better job of letting people know, in addition to the things that they feel are quality, we need to tell them how we also measure quality so that they can leave saying, oh, I didn't even think about that.